Throughout time, humanity has persevered in discovering innovative technologies, thus improving the development of several treatments for disease. Even with so much triumph, there has been one presence that has followed humanity in all our endeavors. Liver cancer will always ride first class and show up to any family reunion, party, or birthday, even though it was not invited. For many, this was a never-ending nightmare. But with today's innovative therapies, such as radioembolization, it has provided stability and a future for millions. In 1787, geologist Carl Arrhenius made an incredible discovery of yttrium-90, or Y90, in Jutri, Sweden. This rare earth element was fundamental for chemist Johann Gottelin, whose research increased the progress of yttrium-90 for today's liver cancer therapy. In the 1960s, animal studies showed promising results for radioembolization therapy for human utilization. This yttrium-90 is manufactured inside microscopic glass or resin particles, which are 32 microns in diameter. This is about a third of the width of a singular hair. Radioembolization is a minimally invasive therapy. Although it is not a curative treatment, it maintains and extends the life of the patient. It will target tumors that are too large for surgery or non-responsive to chemotherapy. For example, hepatocellular carcinoma is a malignant liver cancer that has a life expectancy of 6 to 20 months. It introduces 700,000 new cases every year. Planning is essential for this therapy. During the first session, an initial angiogram is completed. This is a blueprint of the blood flow in the arteries and veins that lead to the tumor within the liver. This aids in selection of the infusion site and gives a promising idea of which arteries to embolize or block off, preventing radiation damage, typically toward the stomach area and bowel structures. After completing the first session, the patient will rest for 10 days before starting the second session. During the second session, the procedure will, with the use of X-ray guidance, the resin-covered particles of the yttrium-90 get administered through a microcatheter that was inserted through the hepatic artery. This artery directly supplies the blood flow to the tumor inside the liver. As the blood flow slowly positions the yttrium-90 into the tumor, the release of the radiation will start to kill the cancer cells during the following 3 months. Even though patients are limited to only 2 sessions of radioembolization, 70 to 90% of patients will show improvement in their cancer cells. As life progresses, with no signs of stopping, liver cancer continues to rapidly multiply with no remorse to its recipients. However, generational advancements of technology and procedures increase the lifespan of many individuals. Radioembolization therapy helps target specific cells without causing damage to surrounding structures. This development will ease the mind of millions of people who undergo various cancer treatments and make cancer livable rather than a nightmare.